do the intro if you don't want, but okay. Knock, knock, good morning, how are you? My name is Robbie and I'm your nursing assistant. Is now a good time to go ahead and clean around your catheter? Great, I'm not going to be pulling on anything, just going to kind of clean up around it. All right, I'll be back. I'm going to wash my hands, get my supplies. Bam, 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 bam. So now I'd come over and get my supplies.
This nigga be doing 2 for 1.
Right.
What did I do?
I'm getting my bath blanket. I'm getting my incontinence pad. I'm getting 2 washcloths. I'm getting a towel. And I'll get a second towel. I could use the second towel underneath the private area in lieu of the incontinence pad, or I can use the incontinence pad and use a bath towel for my work area. Either which way is perfectly fine. So I'm coming back, I'm keeping my linens away from my uniform. I'm gonna go ahead and lay my linens out. I can put my bath blanket on the bed. All right, as I'm doing this, let me know if you feel any discomfort. I'm not gonna be tugging on your catheter. I'm gonna be very careful about that. And I'm also gonna check your tubing. We wanna make sure that there's no kinks in your tubing. All right, I'm gonna go ahead and pull my curtain for privacy. Raise my bed up. I'm just gonna put this out of my way. We don't want it to drop on the floor. I'll go ahead and open my drawer a little bit and get that ready to roll. All right. Get this bed up to about waist level so I don't hurt my back. We're gonna open this bath blanket up to keep you covered and warm. All right. Want to be careful when you're putting linens on your patient that you're not like waving a flag. All righty. Go ahead and put this out of my way first. Keep you nice and covered here. And then I'll be putting my gloves on. You can have the option of putting your gloves on now, no problem. And then put your bath blanket on. Either which way should be fine. All right. Leave my drawer open just a little bit. Okay, so I'm gonna be positioning your legs up a little bit so I can kind of see what I'm doing. And I'm gonna put this pad underneath you so we don't get your linens wet. Being careful not to do anything to dislodge or pull on this catheter. We don't want to do that. All right. And of course your mannequin over there will have 2 legs. Now see, this is where you have to be careful, ladies and gentlemen, because you don't want to, see how I'm pulling on this catheter?
Oops, snatch it off.
Yeah, you don't want to do that either. You want to be really careful because if she sees tension on this catheter, she'll bust you. So you want to be really careful with this catheter, paying attention to what you're doing. So now I'm going to take my blue pad. Remember with these disposable pads, the white part goes underneath the patient. I could technically have used a bath towel. Either which way is okay with state. So I'm very gently placing this under my patient, but I'm not pulling on this catheter. That's the big thing right there, okay? All right, so how we doing? You doing okay? All right, I'm just gonna cover you up here just long enough to go get my water. I'll let you test the water and we'll get started. I would go in the bathroom, I would take a paper towel and turn on my warm water, make it very warm. I won't do the water for this part of it, but you guys will. Okay, I'll come back, okay. What do you think about this water now that state person? You know, you can just, hey, is this water okay? And then let the state person test it. All right. Go ahead and open my soap so I'm not, oh, this is lotion. Good thing we got the dial in there. lotion soap. So I would go ahead and have my soap open. Ta-da. Okay, I'm gonna do my bath mitt. Okay, I'm gonna expose you just a little bit, all right? My bath mitt. Come around, come up. All right, dipping it in my water, wringing it out. A little bit of soap, a little dab of do ya. All right, you're gonna feel me touch you in your private area. We're gonna spread. You actually touch the mannequin's perineal area with your non-dominant hand. So I spread. Now here's where we're going down the center of my wash rag, the very center. So I'm coming down the center as I touch the catheter. I come down the catheter. I'm gonna hold the catheter as I go down about 3 or 4 inches. Then I'm gonna very gently lift the catheter up, and I'm going from where it comes out of the private area away 3 to 4 inches. I'm still in the center of my rag as I go down, finishing down below, and then I turn the side of my rag, and then I turn this side of my rag. That is number 1, and that would go in the hamper. Okay? Now rinse. Same process. I make my mitt. I come through. I dip. I come back. I spread. Center of my rag. Down the center. When I touch the catheter, I hold the catheter with my non-dominant hand as I'm coming down the catheter. I want to gently lift up the catheter as I clean. Again, see where my rag is? I'm still in the center. I clean from the patient coming down 3 or 4 inches. I'm still in the center of my rag as I finish. And then I go side with this side of my rag and this side of my rag. So I've changed positions 3 times on my rag. All right, this goes in the hamper. Then I take this and I pat dry from top to bottom. Just being very careful again, lifting up the catheter, patting dry. This would go in the hamper. All right, let's get you in this uncomfortable position, get you out of that. And go ahead and I would roll this pad up and pull it out. Being careful again, hold your catheter. As I'm pulling this out from underneath my patient, this would go in the trash can, but we're gonna recycle it today. The legs would go down. Okay, let's make sure your gown is not all jacked up on you. You still doing okay? Awesome. Let me check this tubing. Want to make sure there's no kinks in this tubing, and there is not, no kinks. So now we're just going to go right up over this bath blanket. Okay, and then we're going to pull this bath blanket down, keeping my patient covered. Coming back down. Be careful when you're doing this that you don't catch that catheter tube and jerk on it. So I'm peeking underneath here to make sure I can see what I'm doing. Get this out of the way. Put this over here in my hamper. Now let's go ahead and get you straightened up here as I found you. All right, you did good. Everything looks good. No kinks in your tubing. Everything looks real good. I'll show you what to do with all this in a minute. Okay, good job. Okay. Now I'm going to do this for grins and giggles, and it might impress the state person. All right, I'm going to make sure that I leave your side rails up. I'm going to go clean your basin, and I'll be right back, okay? So I go in the bathroom. The reason I simulated the side rails is it looks impressive. You don't have to do that because they don't use side rails. But I didn't want to take my glove off and have to put the bed down, then put another glove on because I still have to clean this thing. So I just simulated side rails for safety. Go in the bathroom. I'm going to rinse it, dump out my water. Then I'm going to rinse it, dump that out, paper towel, dry it. I'm going to come back. Get rid of that. This goes in my second drawer. Now I can take my gloves off, throw them in the garbage. I can shut my drawer. I can lower my bed. See, I wouldn't have done that with my gloves, folks. I'm just trying to hurry so you guys got lab time. All right, here's your call back. Did I get you a magazine or anything? Great. All right, curtain back. wherever I found this is where I would leave it. Okay, you have a wonderful day. Okay, we all good?
10 minutes.
Okay? Yeah, I did a lot of talking in between.